My staff has learned to hate the following words. I have been thinking. Generally, that means I'm going to make a departure from what it is that I was going to talk about. Because I've been impressed with a lot of the conversations we've had so far, and I'm going to make a little bit of a departure. What do you think is the one or two variables that affects whether or not you're going to die well in this country? What would your guess be? Pardon me? Education.
Where I live.
Resources.
Right. I pose the following word, luck. Because if you know the right doctor, if you know the right nurse, if you know the right person who's driving the ER truck, the ambulance into the hospital, if you know your wife, your husband, remember to bring your advance directives with you when you got to the hospital. It is now a considerable stroke of luck that you get good care in the United States because of all of the various competing variables that we're dealing with in trying to receive good care at the end of life. I pose it to you all now to think about the fact is how organized is your life, how organized is your household so that you are not a victim, if you will, of luck. People should not have to jump through hoops in order to get into their end-of-life stages, and many people in this country still do. So luck, I think, is a significant problem. When I read the IOM report, the first thing that struck me was this is an attempt to try to minimize the opportunities for luck being the key variable in good end-of-life care, because it's an opportunity for us all to take a serious look at what it is that we're doing and to find ways to educate in our own organizations, in our communities, the ways to bring the right people to the right place at the right time. NHPCO is a national membership organization. We have about 3,300 hospice programs that belong, about another several hundred palliative care programs that belong, and about 15,000 individuals belong to our program, or our organization. I will tell you that from NHPCO's perspective, one of the things that we're proudest of is that of all of our members, we take care of about 90% of all of the members that die in hospice in the United States, which is somewhere now between 1.5 and 1.6 million people do receive hospice services every year. Hospice, the ideal of hospice when it began many, many years ago was to create an interdisciplinary model of treatment and care that would provide for that patient and family from the outside of their disease a continuum of services from diagnosis through bereavement. My big support and my big hope right now is we're looking at what's coming out of the IOM report is that we'll each and every one of us try to figure out how we can develop in our own communities of care a series of continuums where people will be able to receive from the very beginning of their diagnosis of their illness a palliative care consultation. They'll receive that throughout the course of their illness and then ultimately will receive, as they move towards the end of their lives, a timely and appropriate care referral to the hospice program in their community. Hospice patients come in and 1/3 of them die within 7 days, 2/3 of them die within about 30 days. And I will say to you, those are in fact the lucky ones. These are lucky people that get referred to hospice care and receive services. Again, hospice is a very imperfect system, as every part of our healthcare system is in this country, but people that get referred to hospice, I think, in palliative care, stand the greatest chance of having a chance to have their wishes honored, their families involved, and conversations about what's going on in their lives taking place with them, not around them as they're laying on that bed. One of the difficulties in being a hospice provider, which I did for many years before I took this job, is the number of people who came to me and said, why didn't we come to hospice sooner? Why did we wait so long? Well, partially it's because of the 6-month or less criteria that's on the hospice benefit, and partially it's because people are afraid of dying, and partially it's because their doctor's afraid of dying, and he wouldn't refer to them either. There's a whole series of reasons why people don't receive the kind of care that they need. But in working together as a team and working through the IOM report, it is a significant opportunity for us at this juncture in time, I think, to change this. The baby boomers, we are a proud card-carrying member of the fact that we are not going to take just anything to good care at the end of life. You know, baby boomers, there's going to be hospice, there's going to be palliative care, there's going to be aggressive therapy. I'm sure Starbucks is working on a death frappuccino for the baby because you're all going to want to have one of those as this comes around, because we are such a large group of individuals who are approaching these issues en masse. We can stand the opportunity, I think, to change the future of the care by working carefully on these things together. So just a couple of last things. NHPCO is committed to communicating to all of our hospice and palliative care members the severe importance of this report and making sure that it gets integrated into all of our communities around the country. We're going to champion quality measures and working with Chris and her team, as we've been doing now for many years, for all hospice and palliative care providers. We will continue to advocate for reforms in a payment system that are currently, right now, incentivizing people to come to hospice way too late. We would like people not to have to be a choice between chemotherapy and radiation or hospice. That's one of the issues we'd like to change. We also would like to work very carefully with our colleagues in the Hospice and Palliative Care Coalition to develop and put forward what are going to be the likely and successful opportunities for continuums as we're looking at the future. We're going to promote this advanced care planning by making sure that from the NHPCO perspective, at every chance that we have on Capitol Hill, we mentioned, as we heard this morning from the two great senators, the fact that we want to make sure that every one of their constituents in their communities receive the best, the greatest opportunity for good care at the end of life, but also for the congressmen and the senators to recognize that these individuals, ourselves included, are voters in their districts, and they're going to want to depend on us for some of their votes. And I think people sort of skirted around this a little bit this morning, but they did use the word inevitability in the fact that this is a recognition on the part by even the United States Congress that everyone dies. Thank you very much.